Hello, my name is Mona Ewan. I am a nurse and a lactation consultant, and I am so happy to be able to talk with you about breastfeeding and or feeding human milk to our human babies. It is a great gift that you're deciding to give to your baby, that you're actually considering doing this. I would say that your body, which is so perfect as an incubator for this new baby, is also perfect at making a wonderful form of nutrition and health benefits for your baby through your milk. I would just remind you that milk making is not difficult. As a matter of fact, you have probably already started making milk in your breast. It's a special first milk called colostrum. You start making colostrum in your milk-making tissue of your breast at about 16 weeks gestation, and that will continue through the first 3 days after the baby has delivered, and actually will continue to be mixed in with the more mature white milk for the first several weeks. So congratulations on your ability to do this, and I don't have to remind you, this is the way human civilization has survived all these years, is because we either fed our babies our milk, or perhaps in some certain circumstances there were even wet nurses that could provide milk for the babies. In the event that you are not able to latch your baby on, that's what we call it, latching on, when they're actually going to breast. If you're not able to do that within the first hour, please try to do it as soon as possible, because babies will enter a deep sleep phase about an hour after they're born. I guess they're tired like we are. So try to take advantage of that first hour if possible, if you're able to bond with your baby and have he or she in the delivery room with you for a while after the birth. In the event that the baby does go to our intensive care nursery for closer observation and care, then certainly we can make a hospital grade pump available to you that actually mimics how a baby breastfeeds, and that will be very helpful too, to get started as soon as possible on pumping if you're going to be separated from the baby. We have 2 lactation consultants here at DCH, myself and Jan Norman. I'm here for 8 days in a row, and Jan is here the other 6 days, so we do provide 7-day-a-week coverage. You don't have to have one of us, get you started pumping, but we would certainly be happy to, and we'll be happy to answer any questions you have about the pumping and or putting the baby to breast, which is the ideal way to feed the baby. With the colostrum and milk supply in general, we'll need to try to remove the milk about 8 times in 24 hours. That's the predictable amount of times that a baby would nurse that would also be necessary to keep up and establish a milk supply in the beginning. This is all controlled by our brains. I don't know if you've ever heard of women who actually induce lactation that are going to adopt children. I mean, even if we empty our breast, our brain gets that signal and we'll start making milk, and we'll continue as long as we continue to empty our breast, which will be a minimum of 8 to 12 times in 24 hours for the first 6 to 8 weeks, and then we'll be able to decrease the number of times to probably 6 in 24 hours. We need to really completely empty the breast when we're nursing and or pumping. We also will provide you with a sterile breast pump kit while you're here that will be compatible with the hospital grade pumps and or the rental pumps. We are going to start a rental program here, so ask us, see if we have our program up and running. If not, there are a couple of vendors, including our sister hospital, who rent the very good double electric pumps. Later on, you can even talk to your insurance company about helping you pay for renting a pump if your baby has to go to the intensive care nursery and y'all have to be separated. The good news about making milk is pretty much we can eat and drink what we want to. Even my little borderline malnourished moms in third world countries make wonderful human milk, and we will too. I mean, it's certainly fine if you want to continue your prenatal vitamins or consider taking a multivitamin later on. That would help, but mostly if we empty, our brain gets that signal and will continue to make milk. Our milk contains live cells, actually 3 types of live cells that provide protection for the baby's health. And our milk also contains many antibodies that are specifically made to destroy, weaken, fight bacteria that might make the baby sick. The colostrum that we have in the beginning actually paints or coats the baby's small intestines with that little mucousy barrier of cells and antibodies that actually keep nasty old bacteria and some viruses from entering the baby's system. And as many numerous health benefits as your milk has for the baby, there are also benefits for moms too, thank goodness. We lose our baby weight a little bit quicker. We burn up about 500 to 700 extra calories every day just making milk. And I kind of equate that to 1.5 Snicker bars. That's the way I like to measure it. We also can like I say, drink what we want. We'll have to, limit our alcohol consumption, but there are ways we can have small amounts of alcohol and still breastfeed if we choose to. We can talk about that more. And most medications are compatible with breastfeeding. We have a book that we're so fortunate to have access to that gets updated every 2 years called Medications in Mother's Milk by Dr. Thomas Hale. And they review medications and herbs and give us an idea of, how compatible they are with breastfeeding. And so we can pretty much look up anything for you too. Your OB docs are also very knowledgeable about what may or may not be compatible with breastfeeding as far as medications go. Another thing about the colostrum I'll mention, and even our mature white human milk, the babies do not become constipated with our milk. The colostrum has a natural laxative effect that helps them remove the meconium, that first bowel movement that they're born with. And if you've never seen it, it just kind of looks like sticky, tarry green substance, almost like asphalt, to be honest. And then when our transitional and more mature white milk arrives in about 3 to 5 days after delivery, that also keeps the babies from becoming constipated. And the great thing about removing meconium in the beginning is they may be less likely to experience as much jaundice, but certainly most newborns do experience some jaundice. If the babies are a little bit premature, or even our late preterm babies, even our term babies can actually experience jaundice, which is the yellow coloration of their skin. In the beginning, it's a temporary phenomenon, and very easy to monitor with just little blood test. A simple little heel stick can determine the level, and that is something we can talk more about too, and certainly your pediatrician and the neonatologist in the intensive care nursery could discuss with you.